I knew I needed to get him outside and I needed to get him walking. That was my goal. Forget about the heel pain. We didn't even focus. We didn't even talk about the heel pain. I knew I needed to get him outside and start loading his foot. 2 years, this foot, by the way, when you're walking, 4 to 6 times your body weight. It can handle 4 to 6 times your body weight when you're walking. But you don't load it appropriately and muscles atrophy. So I told him, we had a long conversation. And I said, we're going to slowly start to introduce steps. And if you think about this, if we were to say, add 1,000 steps a day, to some people that might not sound like a lot. But to someone who's taking 2,500 steps, that's almost 50% of what they're doing. So we introduced the concept of a micro walk, which is a 5-minute walk. So a 5-minute walk is about 500 steps.
Okay.
A 10-minute walk is about 1,000 steps.
Okay.
Right? So that makes it like a little more digestible, right? So you're talking to him, you're like, listen, all I need is 5 minutes. And so we started 5-minute walks. And for the first couple weeks, it was, there were good days, there were bad days, and there still are. But we were starting to build his confidence in movement. We were starting to get him comfortable on his foot again. And it was, it was one of those cases where I just I really enjoyed working with him and watching what had happened, because if you look at step counts, I knew what number I was trying to get to. Because if you look at depression, for example, 5,000 steps a day can reduce the risk of having symptoms of depression.
Mm-hmm.
If you get to 7,500 steps per day, it can reduce the prevalence of the diagnosis of depression. So that was in the back of my head. I'm like, we just got to keep working towards these numbers.